John Hinchey was the founding member of the San Antonio Orthopaedic Group, and he was the first orthopedic surgeon in South Texas and San Antonio. His vision, I think, was to provide the best specialty care that could be had in orthopedic surgery in South Texas. If you look at the places that have become known nationwide for providing excellent care, you have places like the Mayo Clinic. Well, that's how that place is designed. It's a single umbrella, one-stop shop, all the people in the same organization. And I think it's no accident that John Hinchey trained there and tried to transport some of that same sort of philosophy of this single framework of treatment for patients to San Antonio. What we've tried to do over time is to extend this vision of John Hinchey into the present and hopefully on into the future. The San Antonio Orthopaedic Group offers total patient care under one umbrella. This is just a single framework of care and a philosophy of care where the patients can come in and they can see the doctor, they can have their diagnostic studies done here, they can have their surgery done here, they can have their rehabilitation done here, and it's done under the direction of the doctor by employees that are part of the same organization. And I think that's unique in San Antonio, and it's very beneficial to the patient to have that coordinated care. It's not fragmented, and I think the fragmented care is very destructive to the ultimate outcome of the patient. The advantage to a patient coming to the San Antonio Orthopaedic Group for an orthopedic problem as opposed to going, for example, to the emergency room is the fact that you're going to see an orthopedic specialist from the very start. You're not going to have the long wait that you might have in the emergency room. We also have, I think, a very good system for streamlining the patient's care once they get in the door. We have our own facility which is really, I think, state-of-the-art for the United States. We have the CT scanner that's state-of-the-art, as I said, with 3D reconstructions. We have the MRI scanning. We have our PACS system, which is a digital system of transmitting our X-ray images and our MRI images and our CT images to any of our office locations so that the doctor can view those at any location. And not only that, those images can be digitally transmitted to a member of the radiology group that we're contracted with for immediate consultation. The physical therapists and the occupational therapists, the hand therapists are all here. So it's the whole package, and the patients can have that coordinated care that will help assure a much better outcome. When we formed the expanded group, which actually came about gradually over time by the merger of some smaller groups plus some individuals, we felt like we wanted to ultimately have a hub and spoke concept. So we would have the hub, which is the Orthopedic Institute, where we have the majority of our ancillaries, including the surgery center. And then the spokes would be the geographic distribution around the city of San Antonio. Well, this is advantageous to the patient because they don't have to travel a long way for their care. We think it offers the maximum convenience for all patients in the city of San Antonio. So it's been a challenge to do all that, but I think that we continue to evolve and to change with the times and to adapt to it. And I think that it's been a really great thing for the people of San Antonio and for the San Antonio Orthopaedic Group.
The group was prompted to open this clinic because we were frustrated when patients came into the office already angry, waiting many hours at an emergency room, possibly not having the best of urgent care. And then many times they've been looking for an orthopedic surgeon for a week to treat a fracture that was taken care of in an emergency room. The advantages that a patient receives in coming directly to the OrthoNow clinic instead of a hospital emergency room is much shorter wait times. They develop a relationship immediately with an orthopedic surgeon instead of having to either take potluck at the emergency room or find an orthopedic surgeon on their own who may or may not be available when they want to have their fracture taken care of. The financial benefits to patients and the insurance carrier are that there's not an exorbitant fee for emergency room care. To go to the emergency room, there is an emergency room visit, which is very costly. There's co-pays that have to be paid, and the total price of the care in the emergency room is greater than the cost of an office visit with the OrthoNow clinic. To visit the OrthoNow clinic, the cost is no more than a new patient visit in a doctor's office, and then only one copay has to be paid instead of two. We feel that this is a better service to our patients, and when you finish the initial visit at the OrthoNow clinic, you're immediately assigned to an orthopedic surgeon to care for your problem.
My surgical experience itself was amazing and very positive, and the best probably experience I've ever had is in medicine thus far in my life. And it's a one-stop shopping kind of situation here, but it's very welcomed by a person like myself. And I love the team spirit between the patient, the doctor, and the therapist. So everybody's on the same page. So each day I'm getting better and better and better, and it's with this group. I had great surgery, of course, but the group has really helped me progress. That's the first time I've ever experienced that. So it's been a very gratifying experience, and it certainly has helped me heal. I know that.